and we can move from the periphery a little bit closer to the core. Before we know it, we're talking about deep childhood experiences. And we're connecting that. We're connecting almost through time. This is how that childhood experience is showing up right here, right now, as we're talking to each other.
Welcome to the Reality Therapy Podcast, where the truth will set you free.
Welcome. I'm here today with Dr. Edward Perin, who's a psychodynamic psychotherapist connected on X, and I think he's got a lot of very interesting insights, and I think it's going to be a great conversation, so welcome.
Thank you. Happy to be here.
Yeah, so let's start off. Tell us a little bit about yourself and your background.
Oh gosh, where do I begin? I've always been a bit of a rebellious spirit, I suppose. Kind of wanted to do my own thing. I actually studied animation before I studied psychology. I had no artistic talent, so I changed majors, and it was probably the greatest decision I ever made. But I joined the Army after college. Not really a lot you could do with a bachelor's degree in psychology, and I was injured pretty severely when I was in uniform, and so I spent a lot of time in hospitals with a lot of people, both physically wounded and emotionally wounded. During that time, I was connected with therapy services. They have to give you a job even if you're somewhat immobile, and I worked at a family life center on Fort Benning, which was really my big introduction into therapy and therapeutic services. And it made me really want to focus my professional development on psychology. I went into grad school, and honestly, I think it was one of the greatest decisions of my life. Long story short, started working for VA hospitals, wanted to continue helping my fellow veterans, my brothers and sisters in and out of uniform. And it was really around the pandemic that I went into private practice, and the rest is history.
Yeah, so you got a lot of experience working with veterans. Tell me what's kind of your conceptualization of PTSD, because that's like probably the number one thing we hear when it comes to veterans.
Yeah, well, veterans are very often exposed to extreme situations. The thing is that they're repeatedly exposed to them. There's kind of a cumulative effect to it. And so people in uniform tend to get PTSD symptoms that aren't really tied to a single specific event. And that's one of the big limitations of the DSM's interpretation right now, is their criterion A, which is how the DSM tries to conceptualize cause, what does and doesn't cause trauma. It's quite frankly inadequate to describe what causes PTSD in veterans. I don't really want to break down into various subtypes of PTSD, but one of the most common things that veterans go through is a moral injury. It's more about they acted or had something acted upon them that really went against their moral system. And psychologically, it's hard to come to terms with that. Not to get morbid, but an experience of that is in our most recent conflict. Some of our enemy combatants would strap explosives to children and tell the children to charge forward operating bases, forcing soldiers to eliminate a threat that messes them up psychologically, and it makes it harder for them to serve their country. So there are a lot of psychological variables that I think cause PTSD that isn't direct fear of death, if that makes sense.
Yeah. I mean, it doesn't, in the sense that I've never been exposed to anything remotely like that. And so I'm having to imagine something that's really unfathomable to me. But I would imagine someone like you is extremely well qualified to treat that population. I had a guest on here, Cameron Harmon, who's also a veteran. And one of the things he talked about, like it being difficult to deal with, like PTSD from combat and coming back here stateside, it's hard to talk about because trauma gets lumped in with a lot of different things. He said, my experience in combat was trauma in the same way that this young woman who has anxiety going out to lunch has trauma from that. It seems like there's no coherent, maybe in the DSM, but not in society more broadly. We just kind of throw that word around really, kind of willy-nilly. Do you run into that?
Yes, I think there is a subjectivity to trauma. One of the reasons why I think that the criterion A is inadequate, I'm going to paint a very silly example for you. Imagine someone in like a bubble boy situation where they were never exposed to any harm or hardship or stress in their entire life, and they lived to middle age, 35, 40 years old. and they step on a Lego.
Mm.
It's the first time experiencing pain. It's possible that they could go on and develop PTSD symptoms.
Mm.
There are a lot of variables involved. Now that's an extreme, silly example, of course, but there are a lot of variables involved that can protect people against PTSD. There are also some variables that make people more vulnerable to developing PTSD, and those are often missed in the discussion and conceptualization of it.
Mm. Wow. I mean, I'm wondering if you have any thoughts on Jonathan Haidt and Greg Lukianoff's coddling of the American mind, because that's kind of their thesis, is that kids have been protected not just from physical danger, but from any kind of emotional distress. And they get to college where they can't control all the variables, and a lot of them are having breakdowns. You have any thoughts on that?
Yeah, I do think that there are generational differences. I mean, we can see the rise in internet late nights. I think very early on when there was I think it was AOL Instant Messenger that I think most people used, and we started seeing a degradation of in-person social skills. People suddenly had a harder time making eye contact or the confident handshake, right? Very simple things that most people were exposed to. But these same people, if you put them in kind of this online atmosphere, they can be charming, they can be witty, they can be interesting and fun. So there are some generational differences that are influenced by technology and socialization. I joke that I was thankful to at least have time where there weren't cameras everywhere. I mean, we all have video cameras in our pockets at this point. When I grew up, I could be a little bit of a rascal or rapscallion. I could do things and kind of get away with it. But then I learn my limits, and then I can adjust my behavior based off of sort of just general appropriate deviant behavior. It's hard to do now. There's cameras everywhere. We also see helicopter parenting. I have not seen a kid riding their bike unsupervised in a neighborhood in years. And I find that strange because the moment I could ride a bike, I was gone.
Do you see anyone in your private practice where you think like a few skinned knees could have prevented or given the type of resilience that would have given you like a psychological protection against the mental illness you're here for?
Yes, more or less. So I work with a lot of people who are on the autism spectrum, and I'm very influenced by Temple Grandin, and she has
Hmm.
one of her books is called the Loving Push. And the main thesis that she argues is that, you know, when people have some difficulties, social, occupational, sometimes even profound intellectual disability, parents tend to compensate for that. They'll do all the shopping. They'll order for their kid. Things that are within their ability to do. Something simple as just giving your kid a $5 bill and saying, go into that shop and buy whatever you want. It's to teach very basic social skills and how to exchange money for goods and services. Basic social skills that some kids are reaching adulthood without a lot of experience and practice with. And I don't think it's that much of a fault of the individual, and I can't even blame the parents for it. It comes from a good place, but in many ways they are preventing children from struggling. And very often we grow and we mature through the struggle.
Yeah, I mean, it's almost like the analogy that's coming to my mind is if you played sports growing up, say you've got a big football game coming up, and instead of like lifting weights in the gym or going out and hitting the practice field, you say, I need to make sure I'm well rested for this. And so for like 6 weeks before the game, you just do nothing.
Right. Yeah, that might be a little bit too long. I've met some natural athletes where that's how they perform at their best, but they're the exception, not the rule.
Yeah. Yeah.
Yeah. No, that's a great analogy.
Yeah, I want to take a little side trail. I like little rabbit trails sometimes. What do you think of complex PTSD? Because I know that's a really hot topic being debated right now.
I don't respect that conceptualization. First of all, the name I think is kind of insulting to post-traumatic stress disorder because people are thinking that it is divided by severity, that there's regular, typical PTSD that's easy to treat. And then there's this harder, more complicated PTSD to treat, which isn't very accurate. In fact, the traditional PTSD diagnosis actually has more of that startle response, more of the central nervous system distress, miscalibrated central nervous system. CPTSD is mostly shown up in the realm of, how they're connecting to other people, how they're relating to other people. If you actually climb up the severe ladder, there is virtually no difference between the conceptualization of PTSD, severe PTSD, and severe complex PTSD. If you put them at the severe level, the difference is entirely in personality.
Mm.
Some people are saying that it's exclusive, that it's just a reconceptualization of borderline personality disorder. I don't think that's true. I think that there are multiple different personality organizations that could wrap itself around repeated cumulative traumatic experiences, especially in childhood, where often personality disorders develop. But I lost my train of thought for a little bit.
Is there? Oh, sorry. Go ahead.
No, by all means.
Is there some motivation you think behind the people pushing this? It seems like they're. I'm not really sure. Like maybe like pushing CPTSD as a way to destigmatize borderline. I don't know.
I actually think that that is one of the motivations. There was a motivation to do that, I want to say about 20 years ago. They were going to call it childhood trauma disorder, and it was kind of quashed really quickly because all personality disorders are childhood trauma disorder to a certain extent. And I think this is just another attempt at that. The thing is that they have broadened it. And the more we broaden a diagnosis, the more it has a concept creep. It is absorbing a lot of what we already understand from PTSD. I've already said it a handful of times that one of the features that PTSD is failing to capture is cumulative repetitive trauma. That's only in cause. The symptoms are not different. The attempt to really try to identify what symptoms are and are not traumatic, I think, is kind of a waste of time. It takes away from identifying, well, what's actually going on and how can we help it? Most of what CPTSD is conceptualizing is some of post-traumatic stress disorder and some pathological personality organization.
Hmm.
And I think our current model is more descriptive. It also provides more utility in identifying what the symptoms are and what is the healthiest track to treat it.
Hmm. What is your? I mean, you look at this kind of trauma treatment. I feel like trauma informed is one of the biggest buzzwords in therapy, and it's like it's so broad that it almost means nothing. What do you think of EMDR and different types of ways to treat trauma?
Well, I'm a huge fan of EMDR. I don't personally practice it. I've seen the research. It's effective. It helps people, at least on an imaginal level, re-experience some of their traumatic symptoms, and they can talk about it, or they can, just be present with some very difficult feelings without trying to change them, alter them, or suppress them, which can be very powerful. But trauma informed, I don't think that's a term that is meant for us. I've never met a trauma uninformed therapist. And if there is a trauma uninformed therapist, I want to find out what school graduated them. I certainly want to know what state gave them a license, because there were many barriers that should have probably prevented that person from practicing. Trauma informed is a terrific way for people who are adjacent to the therapy profession. I get a lot of my referrals from masseuses and dentists. And I think those are really great examples of trauma-informed professions, because a masseuse understands that sometimes it's spontaneous memory recovery, which is ask a masseuse about spontaneous memory recovery. They don't have HIPAA. They will talk about it all day long. But dentists are the same way. If people have had traumatic experiences and they're told they have to sit still in the chair while somebody leans over them and kind of drills into their mouth, they could have very severe PTSD reactions. And the people who are really sensitive to that are going to be more successful in their profession. So if they say, hey, I'm a trauma-informed dentist, I know which dentist I'm going to send my PTSD patients to. If somebody says, hey, I'm a trauma-informed masseuse, I know what masseuse I'm going to send my PTSD patients to. If a therapist says, I'm a trauma-informed therapist, I think that's kind of redundant.
So you don't like CBT, from what I understand. Hold on. I see some of the things that you say, and I think I understand where you're coming from, but for years before I started seeing clients, I would read tons and tons of books, And CBT is where all the evidence is, and it seems so practical, so logical. And probably about 10 minutes into seeing my first client, I realized, wow, there's a lot of issues under the surface that my little bag of tricks cannot touch. So tell me what you think of CBT.
So I want to be very fair to how broad that term is. CBT encompasses a lot of great theorists and a lot of less great theorists. Typically, when I refer to CBT, I'm talking about second wave CBT, primarily Aaron Beck, the cognitive therapist who tried to really integrate behavioral principles and reconceptualize ego psychology into something that's very practical. Now, his theories aren't awful. I really like, some of the cognitive distortions. It's a great introduction. You can give someone a sheet of all the cognitive distortions and they can read through it and they'll be like, this one's me, this one's me. Oh, I learned very much about myself. But the spirit of CBT, I think, is what really ruined the profession. The spirit of it being, let's break therapy down to its smallest point and let's more or less brand it. And branded psychotherapy has kind of created this typically 12-week model that follows a very rigid structure, week 1, week 2, week 3, week 4. And it is replicable, and therefore it's very easy to study in research settings. And so you can compare it to other CBT 12-week models. You can't compare it to somebody who maybe comes to therapy with borderline personality disorder and they're in therapy for 4 years. There is no way to measure reliably the exact same treatment because there is no such thing as the exact same treatment. No more is there such a thing as two exact same people. But CBT, at least the spirit of CBT, tries to capture something that can be replicable and provided generally. What ends up happening is it makes the therapist themselves the most replaceable person in the equation. If you're doing, let's say it's CBTD for depression, you're on week 4 of CBTD and you move and you go to another person who practices CBTD, you can start up again on week 5 and continue through the protocol. There is a lot that's missed from that. At that point, it may as well just be a self-help book. So AI can do that.
You just led into my next question. So it sounds like you're saying that CBT really takes out the human element. So, if that's true, then what do you think of AI therapists or AI on an app?
A great adjunct. It's like having a coaching companion. So I will tease dialectical behavior therapy. It is perhaps one of the best examples of a manualized psychotherapy. It is very rigid in the way, if you're doing true DBT, you have to hit very specific benchmarks and it's very rigid, but it is remarkably effective. So I tease it. But one of the pillars of DBT are coaching calls, 24-hour coaching calls. If a patient is in distress and it's 3 a.m., they can call and go, oh, what do I do? And they actually don't give you therapy. They reflect on what skills have we been going over in our skills group. What skill could you potentially use in this situation? They'll say, oh, maybe I could go for a walk. Maybe I could use a deer man skill or whatever. Great, do that and call me back if we need to go back to the drawing board. There is no therapy involved. It's just, hey, I'm here. I'm going to help you brainstorm. Go for it. Call me back if you need more help. I think AI is going to be great for something along that lines. When it comes to actual therapy, confronting our emotional experiences, I think there are some limits to what it can do. One day, maybe, if it has cameras, if it can track very minute details consistently throughout every interaction, and if it starts creating boundaries. I can't imagine an AI that has boundaries. I would type in, no, I want to see you every day this week, or, let's do a 90-minute session instead of a 60-minute session. AI is going to follow directions, more or less. I don't know if I'm making any sense.
No, that's a lot of really good stuff. It sounds like at least part of your criticism with the various different waves of second and third wave CBT is that it's shallow. Like when I think of distress tolerance skills with DBT, I think of a really good Band-Aid, right? But not necessarily treating the deeper wound. But it does kind of treat the stuff on the surface in a way. I'm wondering, with some of the stuff with CBT, does it point you to the deeper things that psychodynamic deals with? Like with CBT, you kind of peel back some of the layers of the onion, and then you say, okay, here's your core belief underneath. But CBT doesn't really do anything once you discover the core belief. Could you start with CBT and then, once it's fleshed out, really bring in the psychodynamic? Does that make any sense at all?
I think that would be a great start to therapy. Honestly, I think radical behaviorism, just like pure, like Skinnerian behaviorism, where people say, I have this symptom or I have this specific goal. Great. Here is 3 months of focused effort on you achieving that goal. And you work at it, you chip away at it. You maybe get rid of a single symptom, or you develop one specific skill. Maybe you even achieve that goal, which is awesome. Then most of the time people realize that doesn't solve all of my problems. In fact, that actually revealed a whole slew of other issues. Then therapy can begin because we have addressed that surface. We have addressed the symptom. Now we can address what's underneath the symptom. Now we can address what's underneath that. CBT can do that. The spirit of CBT, again, which is very often a very rigid, specific, in settings where that works, they often have really long wait lists. So if you gave them more time to use some of those skills, it might look a little bit more psychodynamic. Maybe you can get into some of those deeper, more unconscious variables. But very often it's like, no, you've had your episode of therapy, go off and like do that. Make room for other people who haven't even had their first dose. And I get that. I understand that.
Gotcha.
Once the book is closed, good luck.
Yeah. So your preferred modality is psychodynamic. I feel like, anybody who knows like a little bit about psychology is probably going to be a little skeptical of that. You've got Freud, who's obsessed with sex and doing cocaine all the time. You got Jung, who's talking about dreams and stuff. Like all the other theorists are writing this incomprehensible prose, Why should I trust like a psychodynamic model?
Well, first of all, those people wrote 100 years ago. I like to joke about them and make memes about them because most people have heard of Sigmund Freud. A lot of people have heard of Carl Jung. Very few people have heard of Nancy McWilliams or Otto Kernberg or Glenn Gabbard. If I were to make a joke about them, 99.9% of people aren't going to get my joke. But we have learned so much over the last century of psychotherapy, and a lot of it is passed forward. And what I mean by that is there's a big mentorship tradition in the psychodynamic and psychoanalytic therapy spheres. They test the theories. They evolve them. They grow them. They learn what does work, what doesn't work, what could work better, and they pass it forward to their mentees. And there are so many cousins and second cousins and third cousins that they could look radically different from each other, but many of those principles have been passed forward. Psychodynamics specifically, if I were to get more into the definition, it is looking at the independence and interdependence of psychological variables at different levels of awareness. Freud had his famous topographical model. There's the conscious, the preconscious, then there's the unconscious. Those are really easy models to work from, but we actually have so many different levels of awareness. If we're tired, we're operating from a different level of awareness. If I'm talking to you versus I'm talking to somebody I've known for like 30 years, we're going to be operating at different levels of awareness. If I were drunk, I'm fairly caffeinated right now. I'm operating at a different level of awareness. We can identify that there are so many variables that interact with each other, and some of them are separate from each other. And we want to look at all of them to get a cohesive picture of what's going on and what realistically can we do about it. CBT, by contrast, here are very specific, observable, measurable clusters. Which of one of these looks most like you? Great. We're going to work on that for 3 months.
Interesting.
I don't know if I made any sense with that.
Yeah. I feel like there's a lot to flesh out with like the psychodynamic or psychoanalytic. Here's a weird question, so I apologize in advance. Do psychoanalytic people are like 4 or 5 days a week for 5 years? Do those people look at you the way you look at CBT people?
Possibly. I have heard some ivory tower stories of like very rigid analysts. Now there's a barrier. There's a wall built around psychoanalysis. One, you have to have been analyzed. Two, you have to invest a certain amount of time in a credible psychoanalytic institute who will essentially grant you the title of analyst. That is not something that most people can afford, let alone are willing to put the time and effort into. So most people learn from psychoanalysts, they study psychoanalytic literature. They just don't go into that level of rigidity. I think Freud did 3-hour-long sessions. I don't do cocaine, so I don't think I could pay attention for 3 hours straight and then see another patient for another 3 hours. I think that I would probably need some chemical assistance for that, that I
That's
would probably
reasonable.
impair my ability to do therapy.
That's reasonable.
Uh-huh.
Do you feel like the psychoanalytic or psychodynamic approach, the way you talk about these institutes and we're getting into the unconscious, it seems like a way to secularize the religious conception of a soul. Do you see it that way?
Many original conceptualizations of the mind were conceptualizations of the soul. I mean, Freud wasn't really the first psychological thinker. There were psychologists before Freud. Freud was actually a neurologist anyway. We can trace it back to philosophy. We could trace it back to the sophists. Socrates would go door to door and be like, "Can I solve your problems with logic?" And he used the word soul as well as the word mind. And then we can look at some of those early philosophers, and there is not much of a difference between how we subjectively experience the world and something that is outside of ourselves. They didn't have a strong understanding of the brain. The Egyptians didn't even think it was that important of a body part. So I don't know if I'm answering your question,
Yeah, yeah,
but I
definitely.
don't think it was really until Descartes that we really started separating the mind from the body. And I think he believed the soul was in the pineal gland. But
Mm.
yeah, philosophers are funny.
Yeah. I think one of the reasons people, especially researchers, like CBT is because it's very easy to study. It's like you have these exact metrics and you hit these metrics and good or no, bad, and there seems to be a lot more variability and ambiguity with kind of the psychodynamic model. You can't study the unconscious very easily. How do you observe the unconscious of a person when you're in session with them?
It shows up. It shows up in how we communicate. It's showing up in how I'm communicating. My unconscious is showing up in how I'm communicating to you. Your unconscious is showing up as you communicate to me. Very often we have to maybe dance around the periphery. We could be starting to talk about the weather, and maybe a comment or some emotional content will slip out, and I can tug on that thread, and we can move from the periphery a little bit closer to the core. Before we know it, we're talking about deep childhood experiences, and we're connecting that. We're connecting almost through time. This is how that childhood experience is showing up right here, right now, as we're talking to each other. And if I do my job right, that is felt. That isn't just intellectual, which CBT in many ways just teaches people to get better at intellectualizing. There is a 2-foot drop when you connect with the unconscious. You can see eyes blur over. They are not seeing me. Their body is not in 2025. They are seeing almost primally what caused early
Mm.
relational difficulties, and they're feeling it. They're embodied with it. And my job is to get them to kind of stay there and feel it.
One of the things I hear, like your psychoanalytic or psychodynamic people say, is like with the CBT type thing, it's very Skinnerian, and like you've changed the behavior basically, or you've changed the specific thought process. But one of the things I hear about like the psychodynamic side is there's like a personality change, like a much deeper, more profound change in the person. Do you see that in people you work with?
Oh yeah, all the time, every day. It's what fuels me. It's what moves me. I like to look at it as a matter of vitality. We could call it aliveness. But you see people living. It's really hard to put into words. They'll say their relationships are better. They're going on adventures. They're talking more authentically. They're confronting bosses. Their overall subjective experience of life is positive, even when they're in hardship. Like, they could be undergoing extreme stressful situations and they're still alive. They're just solving these new problems with new and adequate solutions, with that sense of, I guess, a new sense of spontaneity, a new sense of creativity. They're just more alive in ways that you're not going to track with one of Aaron Beck's, you know, Beck depression inventory or Beck anxiety inventory. Oh, I went from a 32 to a 15 and in thoughts of not liking myself. Some of the real profound insights about living and feeling more alive can't really be measured. Certainly we anticipate what symptoms or what aliveness they're going to start feeling until they start reporting it.
What do you think of positive psychology and how that pertains or relates to psychodynamic? Because I feel like some people really judge the positive psychologists, and there is a bit of fluff and woo woo to it. But I feel like the basic idea that psychology should be more than symptom reduction, like thriving and living a fulfilling life should be a primary goal. So, what do you think of that?
Oh, absolutely. I think that one should be able to authentically live in the life they have. I like positive psychology in theory. There is a point where it's not positive. There's a point where it's naive.
Ooh.
And I think naivety can be just as dangerous as pessimism. There can be so long as you're still within the realm of reality, positive psychology can be very helpful. Positive psychology can transform. I tend to think that I'm somewhat a positive psychology follower. I
What's an
just try
ex-
not to be naive.
Yeah, what's an example of somebody being naive or going kind of off the rails in that direction?
Well, I'm going to have the best day ever. I'm just going to wing it. I'm going to go in with my boss and I'm going to tell him I want a raise. And if he doesn't, I'm going to give him a one finger salute. I'm going to walk out and I'm going to start my own business. In fact, I'm going to start a business that's even more successful. Yeah, there's a point where it's not necessarily congruent with reality. Is it possible? Sure, anything's possible. Is it likely? Maybe temper expectations on how easy or fun that's going to be.
Mm. Well, I heard you say once something to the effect of, or post, I guess, something to the effect of, I could really use an old school analyst right now. What is an old school analyst and how would that person help you?
Well, I found one. It took a lot of work. He's old as dirt. I joke. I'm pretty sure he was around during the Prohibition. He's not that old, but he doesn't say a damn thing. We established the frame. I come in. I talk. I yell at him when I want him to say some things, and really, he doesn't really or intervene until he has something to say. If we were to really break this down into technicality, this is called tracking derivatives, tracking derivative communication. Very often what we're saying, if we're talking about what we are relating to another person or what two people might be relating to each other, what we might really be talking about is how we're relating to another person or how we're relating to someone other than who we're talking about. Sometimes it's the therapist. I could be talking about a parent, a friend, a neighbor who's pissing me off. And once every couple of months, I'm telling you, there's a long gaps between him just cracking me open. He'll be able to say, I wonder if what you're really talking about is what's going on here in this moment. And he'll say that in a way that locks me in. And suddenly I am aware of so many dynamics that I had not paid attention to. And I sometimes break down, I'll blubber, or I'll stop. My eyes will glaze over. I'll look like a baby that just, drank a really big bottle. Like, think about it for a little bit. Sometimes I'll go off and I'll have a really shitty week, because he made me aware of a way I was maybe protecting myself in ways that I hadn't experienced. But like, this happens every 3 to 6 months since I've started working with him. He listens, he pays attention, he does not take any of my bullshit. I'm impressed by it. I don't think I could do therapy that way. I don't think that I have the patience for it personally, but it does wonders for me.
Wow.
I don't know if I answered your question, but
No,
the
you definitely did.
school analysts do not intervene very much.
Okay, yeah. I mean, this is kind of like a sidetrack, but you seen like Goodwill Hunting?
Mhm.
where he has just like that one line, "It's not your fault," and then Matt Damon just breaks down. Just like, I think there's like this in the mind of a therapist, it's like this is like the Michael Jordan of therapy, to have that kind of a moment, like what you're talking about.
Well, that's the tracking derivative communication. He probably had that in his pocket one of the first few weeks he started working with Will. He says, "Oh man, he had a tough childhood and it's not his fault. He won't be able to hear it if I told him this now."
Wow.
If he said that on their first meeting or their second meeting when Will was still testing him, "Hey Will, it's not your fault." It would not penetrate. Will's defenses are going to be solid. He's very smart. He's very adept. He'd be able to deflect it. He'd be able to turn it around. Or it just wouldn't penetrate at all. He knew the right time to say it. That, I think, is the old school analytic art that we're actually at risk of losing because they're all old and retiring.
Well, if this is, I mean, it sounds like this magical thing and an incredibly transformational thing. Why are we losing that skill?
It's not needed for a manual. The timing is on week 1, you do it, you do this. On week 2, you say this. On week 3, you give them this worksheet. On week 4, you check in with them. It's very rigid. They don't talk about, tracking derivative communication and testing a hypothesis. Maybe you'll say, "Hey, Will, it's not your fault." And you watch it bounce off and you say, "You know what? I still think that that's accurate, but I haven't hit the time right. I'm going to keep that in my pocket." And maybe a few months later, "Hey, Will, it's not your fault." That's when it penetrates. Part of it is trial and error. There's no shortcut for that. I liken this to comedy. Comedians understand timing. Have you ever seen movies where comedians do like dramatic acting, like drama, like serious jobs,
Yeah.
yeah, they're great at it. They're fantastic. You ever do see a dramatic actor try to do comedy? It's not for everybody. Some people just can't do it. But to me, that difference is timing. A comic who understands timing can do any emotion. They can do drama. Dramatic actors can't do comedy. But that is over a lifetime. They have honed that. Who am I thinking? Jim Carrey. Jim Carrey is a really great example of that. He had a terrific slew of very serious, somewhat jokey movies. One of them that stands out is The Majestic, because at one point in time in The Majestic, he tells a joke, and it's fine. It's an all right joke. It's a little funny. Can you imagine how talented a A-list comedian is to only tell a joke that sounds like a normal person told it? That's about 3 levels of talent and ability and timing and knowing how to pace themselves. Comedians, they go in and they test their material. They get booed. They get booed off the stage. They do terrible sets and they go back in and they talk with each other and they go back into their notes and they recraft it and they craft it and they craft it. After about 10 years, suddenly they can just write a show. But that did not happen overnight. Jerry Seinfeld couldn't act.
Yeah.
Jerry Seinfeld used to be a very terrible actor. And when he first got a show, all of his peers are like, "Him? That show ain't going to do very well." He showed them, but he worked at it. He practiced. He trained. I think analysis and being able to understand timing, it's very similar. There's no shortcut. You need supervision. You need training, but you also need practice. I think that's why we call it a practice. I feel like I'm just getting long-winded here.
No, it's all good stuff though. So I love it. I want to switch gears just a little bit and talk about, you're a man in a pretty female dominated profession of psychology, psychotherapy. Men are struggling right now. Men are dropping out of education, dropping out of the labor force, skyrocketing rates of mental illness, suicide, addiction, all kinds of stuff. What is going on with men right now?
We have issues that disproportionately impact us, and they are not getting attention. I mean, that's really the long and short of it. We talk about it. We try to talk about it. It gets shut down. It doesn't just get shut down in casual conversation or public discourse. It's actively pushed against through the American Psychological Association. In 2018, the APA released 2 guidelines, the guidelines for treating girls and women and the guidelines for treating men and boys. I can't remember which comes first, but the remarkable thing is if you read one of them individually, some things might seem a little off. The men and boys one might seem a little insulting in different parts, but, on its own, it might not sound terrible. But if you read them together, you identify that in many ways they're talking about the same traits. The same traits in women celebrated and talked about and encouraged, like independence, competitiveness, ambition, right? Ambition in girls and women in the APA guidelines are to be encouraged. That those very same behavior traits, when talked about what they call traditional masculinity, or what the APA was calling traditional masculinity, is something that needed to be pushed against, something that, now hold on, do you really need to be competitive? Do you really need to be ambitious? There are other ways to be a man. There are other ways to you don't have to be going after that CEO job, right? Seeking power is actually kind of bad for men. But again, you read them back to back, they're talking about the same behaviors. In psychology, we call this a gamma bias, where, the same behaviors, depending on, in this case, gender, male or female, can be celebrated in one, but discouraged in another. And we see this with power. We see this with privilege. We see this with victimization. When men are victimized, it's minimized. When women are victimized, it is amplified. Now, I don't think that it's bad to amplify voices. There are issues that disproportionately impact women, issues that we should talk about, even gender issues, way men treat women, that we should talk about. We should also talk about these issues that disproportionately impact men. I don't believe that this is a zero-sum game. I think this is a matter of coalitions. We work together to identify the areas that do discriminate, but impact us differently. Unfortunately, that's not the vibe. That's not the tone.
Yeah, this is a really tough thing for men to navigate, to understand, to go through the modern world and say, what is healthy masculinity? Because I feel like a lot of mainstream society, including mainstream psychology and counseling, are pushing a very emasculated vision of masculinity. And a lot of these men are running to a very dangerous version of masculinity, kind of your Andrew Tate, chest thumping, egotistical. And I think that's almost a predictable response to kind of what you're saying. It's like, hey, we're going to welcome these natural traits over here. You see that?
But yeah, almost to a performative degree. I actually don't think that those caricatures are very masculine. The tricky bit here is that we are identifying behaviors that are masculine or behaviors that are feminine, and I don't really think that exists. I mean, if a woman is ambitious, great. If a man's ambitious, also great. I don't think that we should determine that one of them is toxic based off of what genitals they have, and one of them is celebrated depending on what genitals they have. One of the things that I say is there are no toxic demographic variables, just toxic behaviors. That being said, there are some things that are typically masculine. I mean, we have beards. We're bigger. We're more likely to want to externalize. We'll play sports. We'll want to get in fights. That doesn't necessarily have to be a bad thing. One of the ways men are often socialized is they are encouraged to build a tough skin. An example I like to tell about this was Boy Scouts. When I was in Boy Scouts, we would hold each other down. I'll pick on myself. I was held down and tickled, right? Until I could not be ticklish. Now, there was a lesson in that. It was, have self-control. Don't be, so soft-skinned or receptive to how other people could manipulate you. I actually value some of that feedback. It's in the military, it's necessary, right? Because if you're going to be overseas and, people are going to shoot at you, you need to be able to take an insult. So, these drill sergeants, they'll have their hat, over their eyes, and they'll look mean, and they'll come up with the meanest words for you. And it's to make it so that you don't care if someone yells at you. If you don't care if someone yells at you, you're going to be more likely to survive an actual firefight where someone's trying to kill you. And it's enacted also within their groups of friends. If we're in the barracks, whatever your biggest insecurity is, that's your nickname. If your ears are poking out, your nickname's Shrek. If you have glasses, your name's Four Eyes, right? If you're maybe even just a little bit overweight, you're Tubby or Piggy or Bitch Tits or whatever it might be. And you'll see these people just say the meanest thing to each other. And to an outsider, they'll be like, that's so terrible. That's horrible. But you look at them, we're laughing, we're smiling, we're bonding. We're getting the vasopressin bond, like we're connecting in ways that a lot of women don't. If female friends did that, they'd hate each other. They wouldn't be friends anymore. So I do think that there are some things that we can look at that we don't actually think are toxic. They provide a benefit. It can be taken too far. But I don't think that we should start looking at some of these behaviors and start calling them toxic. In many ways, they are celebrated in male culture and in male friendships.
I feel like male culture seems to be like highlighted as part of the problem. And we're kind of getting back to what you were talking about earlier, where this type of resilience, building a thicker skin is necessary, and I think we're being told, oh, that type of toughen up mentality is toxic. And then I think a lot of men were told, well, we want you to be vulnerable. And so like there's some men who are vulnerable and the response is, what are you crying about? You have all the privilege. So it's kind of a double bind a lot of time for us men.
And in my experience and a lot of what I've observed, that it's not really the men who create that expectation. It's the women in their lives. It's mothers, it's sisters, it's girlfriends, it's love objects. It's people who they really care about. They're the ones who I might be butchering this quote here, but it was a gentleman said, my wife and my daughter would rather see me die on my horse than to fall off. Probably butchering the quote here, but a lot of that expectation is put on by female relationships. Male relationships, when it's actually like a close bond, one of the reasons why they encourage that tough behavior is so that we could survive some of our female relationships. And I think the difference is in the intention. If somebody is just abusing you for the sake of abusing you, yes, that is toxic. But if you're in a male friendship group, or if you're maybe an older brother and you're, expecting, and you're telling your little brother, no, try harder, keep going, push yourself. They're actually trying to teach them. They're trying to encourage them to grow, to mature, or to develop a thick skin that could make them more successful in a world that hates them. In a world that might have a nature doesn't feel, nature will eat you. Nature will kill you. At any moment, lightning could strike and be like, screw that guy in particular. Done. Men try to prepare each other for that, especially if they need to count on each other. I don't think that is necessarily toxic. It can appear toxic to people who are not in those relationships. But I think that is different from somebody who's just like, I don't like you, I'm going to beat you. Or you're ugly, I'm going to make fun of you to make myself feel better. Those behaviors are toxic, and I think those are toxic whether it's done by men or women.
So I think there's specific problems affecting younger men. We talked about this kind of like heightened Lukianoff coddling of the American mind, but specifically with men, I forgot the statistics, but it's like a really high number. Never had sex, never had a beer, never asked a girl on a date, just kind of like retreating from natural parts of manhood and what were once natural parts of our development. What do you see going on with younger men?
I think there is an influence intergenerationally, but there is also an influence in technology. Culture has changed over the generation. If I were to look at my grandparents got married very young, and it was because when they grew up, it was expected you reach adulthood, you turn 18, and you start looking for a wife, and you start your own family. So they all just understood, you turned 18, you find a husband, you find a wife. So they did not have a long courtship. They did not date around. They ended up getting married, and they started having children. Over time, we see that gap getting larger. There aren't, what would I call them, social rules. We'll go back to the 90s. If you were at a bar and you saw a lady, and you would tell the person, I'd like to buy her a drink, they'd bring the drink over to her and say, oh, this gentleman bought you a drink. If she accepted the drink, it means come over and talk. If she said no thank you, that means I'm not interested, no thank you. Like they understood the rules. There aren't rules anymore. There are no rules. You can swipe and summon another date from the internet. You buy a girl a drink at the bar, she accepts it, you go over to talk to her, and she'll go, hey, whoa, what are you doing talking to me? But hey, thank you for the drink. Women also are not asking men out. Despite this new egalitarian culture, that is not reciprocated. Men are not being chased. And so a lot of men, because they're trying to hold back, they're trying to meet social convention, not come across as creepy, they're also not being approached, and then nobody's happy. The thing is that we have models of cultures that are a few years ahead of us. Korea is struggling with this. Japan has struggled with it for a long time. They have one of the highest rates of unmarried people. They have one of the highest rates of virgins under 30, virgins under 40. They've had a loneliness epidemic long before the young men and women of the United States. Some of the technology that has come to compensate for that, not just AI girlfriends or AI wives who can turn lights on and off for them when they come home, but they're having like hand holding technology. I saw a device where it was kind of a robotic mechanical hand with soft padding, but also a counterweight. When you're walking, it feels like it's pulling back on your hand a little bit to simulate what it feels like to go on a walk and hold somebody's hand.
The first thing that comes to my mind is this sounds like the difference between deep psychodynamic work and doing a manual in they're both therapy. Like, the manual would be holding this synthetic hand.
I mean, essentially, Japan has one of the most innovative sex toy industries in the world because they're not having sex with each other. So they have very realistic sex toys, even I think disposable pocket lady genitalia. And I'm told that in Japan, you get really good genitalia and then you throw away after use, right? Like it's just this simulacrum of actual sex. I feel that way about AI. I would rather have the real thing than get a simulacrum. But because of the culture, that's not an option. Just to give a little bit of how that culture, they care very much about the social contract. Here's a very specific example. Japan celebrates Valentine's Day, and it has a holiday 1 month later that they call White Day. And on Valentine's Day, you don't get flowers or gifts. You get a chocolate bar. And you get one chocolate bar and you give it to the girl that you like best. And you walk away. That is Valentine's Day in Japan. So a girl might get 0 candy bars, she might get 1 candy bar, maybe she'll get a whole bunch of candy bars. She gets to pick one. Whichever one person, 1 month later, on White Day, after 30 days of waiting, she chooses the one she likes best and gives him a candy bar. After that, they're dating. Do the math on how often you think that actually ends up in a pair bond, in a long-term, meaningful relationship. So many people, because they're going to do the social convention, they will wait an entire year to give another chocolate bar to another person, rather than what an American might do, go to a bar. Hey, you're cute. Hi, I'm Ed.
Wow. One of the things it feels like in America is you're encouraged to tone down the masculinity, kind of this emasculated vision, and it's almost marketed to us as though like this is what women want. But the real world that I think you and I live in, women like masculine men, and we've been duped by that. And I think there's this, on the one hand, I want to fit in with social conventions of toning down my masculinity. And on the other hand, I want to get a date. And it's very confusing for us men to navigate how I should put my masculinity into the world. How do you observe that?
I personally don't find it confusing. I thankfully dated before Tinder. I remember when Tinder was weird. It occurs to me now that there is nobody under 30 who has ever been in the dating world without the existence of Tinder. That is hard for me to wrap my head around, but it is something that I have to exist. I have a friend, she's in her mid-20s, and there was restaurant week here in Ohio, in central Ohio, and there was a dish that she wanted. It was essentially animal style fries from In-N-Out Burger. I don't know if you're familiar, but
Yeah.
In-N-Out isn't in central Ohio, but there's this people who did an animal style fries and she wanted it. And we went online and it said unavailable for online ordering. And she got very disappointed. She was like, oh no. I said, that's fine. It just said online ordering. And I pick up my phone and I'm like, yeah, I'll just call them. And she unironically swooned. She's like, you would call them on the phone? It's like, yeah, why is that? Why is that weird? She's like, the boys I date would never do that for me. It's like, really? Yes, I don't want to call on the phone. And I scratch my head a little bit because I'm thinking like, really? Is that the bar for dynamic masculine behavior these days? Is just calling a restaurant and being willing to put in a phone order? I
You
don't
know,
think that's a very high bar.
I think that's kind of like the good news for us is like the bar for masculinity is very low. You can be an alpha with very minimal minimal behavior.
a double-edged sword. Sure, I could benefit from it, but might have deep sympathies for people who have to learn what I would consider. I learned some of this stuff in high school. I learned some of this in college. I went through a libertine era. Like it was not, I dated not seriously. I look and I see 19-year-olds, 20-year-olds, 21-year-olds. They're not doing that. I, one doesn't have to do that, mind you, but I guess I look at it as two different inhibitions. If one person said, I want to save myself for marriage, I only want to date with intention, I want to get married, and want to have a serious relationship, great, right? Don't ask girls out and sleep with them. There's another version where someone says, gee, I would like to ask these girls out. I would like to go on dates. I would like to go to a party and maybe, talk up the cutest girl at the party, but I'm afraid, so I'm not going to do it. I'm going to stay home and then I'm going to regret it. That inhibition, I think we need to smash with a hammer. I think that that is more motivated by fear of abandonment, fear of rejection, fear of social alienation for being a creep. Very real things that I think men under 30 are struggling with.
So we talked about this in terms of the gender bias issue. How do you think political bias more generally is affecting the field of psychology and therapy?
Well, there is typically one political party that is celebrated. Very often when people say therapy is political, they're talking about a very specific, narrow range of politics. I don't care, but I think that all politics should be described, understood, taught. Our politics don't matter. Our clients' politics are what matter. That somehow got lost in clinical training. When I was in graduate school, I think Trump was going through for the first time, and we had colloquium. We had a colloquium trying to understand why people of low socioeconomic status were voting for him. And I really got an idea of what my professors thought of Trump voters. Now, I don't think I'd really want to spend 5 minutes in a room with the guy. It seems like I wouldn't be able to get a word in edgewise. That's not my point. I grew up in Ohio. Ohio's a Republican state. I come from a farming background. I had my first rifle when I was 7 years old. At our farm, we have a coyote problem. So coyote season is 24/7, 365 days a year. These people could not comprehend why anyone would want to own a firearm because they lived in a major metropolitan city. They didn't consider that people in rural or highly rural environments might have them for safety reasons or to maintain their way of life. The coyotes could kill livestock. There are very reasonable ways to have a gun, and you get kind of that extreme idea. There's no reason that anyone under any circumstances should have. If I were to speak out about it, I would get pushed back on very specific issues. My response was usually, there are a lot of gun owners in this country. Would you not treat them? Would you consider that pathological? Would you try to cure them to give up their firearm? I had to bite my tongue, unfortunately, because that was not a fight I was going to win. But I do think that there is not much of an understanding that people might think differently, vote differently, or have different political values.
I grew up, a lot of my upbringing was in rural Texas, and, coyotes, hogs, skunks, possums. I mean, that's like,
Hogs are dangerous.
yeah, that's the season all year. Like, you can't just let them roam free, But there seems to be this mentality that there's this irony here, because the mentality is we are the ones who care about those who are at the bottom and who are suffering and who are marginalized and all this. We have this bottom up, mentality. But then when it's kind of spoken, the mentality is, why are the unwashed masses not as enlightened as us?
Yeah, I do think that there is an ivory tower, almost a political ivory tower. We are enlightened. We understand everything. And that's fine. Vote your conscience, have your values. Don't impose it on our patients. That is my kind of takeaway. That's easier for me to say. I tend to be somewhere in the middle. I have varying beliefs, right? I have some left-leaning beliefs. I have some right-leaning beliefs. I can kind of see both sides and understand why they do it, even if I don't agree with it. Heck, sometimes they are in direct competition with each other. I can be a little hypocritical with my beliefs, as everyone can. But as we get kind of to the extremes, I believe in the horseshoe theory that the more
Yeah,
extreme you get, the more they start looking like each other. And I don't mind other people who can take perspectives. The modern professional psychology graduate environment seems to be leaning towards one of those extremes to, I think, the detriment of anyone who might be there who votes differently or thinks differently, but can't express themselves.
I agree with that 100%. I have two questions left. The first one is very simple, should be pretty easy for you. How do we fix the therapy profession?
Can we fix the therapy profession? If I were elected dictator, uh, I would I would really focus more on depth training. I'm a huge fan of social workers. I think that social work is the backbone of the mental health profession. They are the ones who are in the trenches. They are getting in cars. They are filling out paperwork. They are making sure that people get connected to resources, to necessary resources so that they can get better and thrive. When I was working in community mental health, I think there were about 40 therapists and 4 social workers. I think that should have been switched. I would get somebody who was, addicted to heroin or hasn't eaten in 4 days, and they'll come in and they'll be like, "Oh yeah, I'm homeless, but I really want to work on my depression." And I was like, "It's winter. It is February in Chicago. Like you can die out there. I don't think that your depression is the most pressing issue right now." But I'm trained in a method of really getting into like the depth and the unconscious. That is unnecessary right now. I need to give you a gift card to, Dunkin' Donuts or something. Like get a bagel. I think that we need to be really prioritizing in the trenches, social work, direct patient care, getting people connected to resources. And then I think that there can be psychotherapy. Let psychotherapy be kind of its own standalone, very specific thing. I look at it as something that's developmental psychotherapy, even throughout the adult lifespan. What do you actually want to work on? Great. Let us work and move in that direction. I think psychotherapy should be developmental, not corrective. If we have to correct something, I think that there are other approaches to addressing that. I'm not entirely against corrective psychotherapy, but I think that we really should be focusing more on the developmental side of it. I think it's going away. I certainly think that I'm not against manualized psychotherapy entirely, but I don't think that it is the gold standard. It is considered right now the gold standard, evidence-based psychotherapy. That should just be a start. That should be the corrective psychotherapy. What is the symptom that you want to work on? It is like a scalpel. You go in there and you cut out very specific, an individual symptom, and then maybe that's exactly what you need. But psychotherapy is developmental, it's personal. And I think we need to get back in touch with that.
I like all that. My final question is, when you look at society more broadly, what is one thing that we're not talking about enough that we should be talking about more?
Gosh. I'm on social media. I don't know what isn't being talked about. Right now, the big discussion that I'm following is nutritional psychiatry, looking at diet, nutrition, and the impact on mood. This is something that I've had my finger on for maybe about 8 years now. There have been very promising studies that diet can alter the course of things like bipolar disorder, ADHD symptoms. Some people are talking about diet improving autism symptoms. I'm thinking it's probably improving symptoms adjacent to autism, but the research is out there that there are dietary alternatives to medication. I was diagnosed ADHD when I was 7 years old. I was a Ritalin kid, hated it, didn't like how it felt. If I were told that there were nutritional alternatives, cut back on sugar, certainly not sugar in the morning, I think that I could have had better outcomes. There's also that critical developmental piece of the developing brain. What we are eating has an impact on how our brain develops. I don't know what school lunches looked like when you were going through, but we had these square pizzas and chocolate milk that were great. God have mercy on all of the teachers that saw us after our lunch hour because we were just carved and sugared out of our mind. You probably had to scrape us off the ceiling with a rake. Our prison system has done a lot of research into this. If prison systems spend actually not even that much more money than their previous food options, more protein, more vegetables, some fruit has sugar in it, but some natural food, we saw less behavior problems, fewer violent events. People were more civil. People could follow the rules a little bit better. We learned this in prison systems. What happened overnight? All of the prison systems started utilizing this because they got to save money because there were less behavioral challenges with their inmates. Our schools haven't. Our prison system feeds our prisoners better than our schools feed our children. And I can't think of a single thing that benefits all American citizens better than feeding children healthy nutrition that will influence how their physical brain grows. I'm over 25. My brain is done growing. There is neuroplasticity. I can make a few changes here and there, but for the most part, the shape of my brain is what it is. I don't think that we should deny that from children. I think we should actually focus on brain development, not medication. Or not entirely medication.
Yeah, yeah. I have a single case study design, and that's myself. For a number of years, I was diagnosed with a slew of different things, the most potent being bipolar disorder. And I made a number of changes in my life, but the biggest were diet and exercise. And more recently, I met with a psychiatrist and a therapist who said, if we were to meet you for the first time today, we wouldn't diagnose you with anything. I mean, I'm a big believer in lifestyle changes. I love talk therapy. That's obviously why I'm pursuing this. But just it would be so hard to make meaningful changes without that foundation of what creates your biology.
If you look at just regular meal cadences, a regular sleep-wake cycle, you will significantly decrease, if not eliminate entirely, swings, bipolar swings. We see this in schizophrenia as well. The more you keep a regular diet, regular meal cadences, regular sleep-wake cycles, the less indication or the less chance, the significant reduced chance of slipping into psychotic episodes. That doesn't mean that you shouldn't have maybe like a bottle of a mood stabilizer or an antipsychotic in your medicine cabinet for some of those oh crap moments. Got to hit I'm not sleeping well today. My early warning signs are showing up. I better start taking my medication. Alternatives that a lot of people seek. A handful of people with bipolar disorder have come to me explicitly to say, I want to get off my medication. How do I do that? Is it possible? And I have to have very real conversations of, we can temper some expectations, but there are some things that you can do that will minimize the swing or at least reduce the likelihood of a swing. Also to identify risk factors that the swing is happening. And then, execute plan B, execute plan C, but have plans up to and including going to that medicine cabinet and hitting your oh crap button.
Yeah,
But yeah,
I
no,
still
please
keep
go
a
ahead.
bottle of Depakote around. Just I call it my emergency brake, just in case you need to pull that. But yeah, I mean that's. I think a lot of people would take that option. It's tough because a pill takes zero discipline, whereas changing your entire lifestyle takes a lot of discipline.
Well, so I grew up with ADHD. One of the biggest jokes in the ADHD community is people forget to take their meds all the time. So it actually does take a little bit of discipline if you have an executive functioning
Yeah,
disorder, but there are ways to compensate for that.
yeah. Wow. Well, this was a fascinating, fantastic conversation, Dr. Perin. Thank you so much for joining me.
Oh, it was my pleasure.